Good afternoon, everyone. My name is Isbah Raja, and I would like to thank Mayor Pelosi and Congressman Hoyer and all the representatives here for allowing me to share my story on a national level. I am 21 years old and a student at the University of Texas at Austin, and I have seen firsthand how healthcare and the new law can affect the lives of young people. I hope to share this story on behalf of the many students in this nation that may have similar problems. When I was 18 years old, I started to have symptoms of fatigue, making it hard to concentrate or complete my schoolwork. In the same year, my father transferred jobs, and we now had to find private insurance coverage. However, when my parents tried to sign me up, the new insurance company denied me coverage based on my history of fatigue. I was left with no options, so I limited my visits to the doctor and hoped that my health wouldn't get worse. I was left uninsured. A year later, I began losing weight uncontrollably. An entire constellation of symptoms sprang up. I visited a rheumatologist who diagnosed me with lupus. Lupus is a chronic autoimmune disease that can result in joint pain, hair loss, loss of appetite, and much worse if untreated. At the time, my father transferred jobs where he would be provided with health insurance from his company. Unfortunately, the insurer again denied me coverage for my pre-existing condition. I was appalled. My parents, who already paid for my college education, would now have to cover all my medical bills as well. In order to reduce costs, I brought generic drugs instead of the prescription brand I was supposed to take, and I limited my visits to the doctor as much as possible. The stress of living with a serious medical condition, being a student, and worrying about finances was an experience that I hope to never face again. Fortunately, we kept fighting, and my father's employer coverage eventually did cover me. And thanks to the new healthcare law, my coverage won't just terminate when I graduate. I will be able to maintain my insurance up to the age of 26, even as I pursue my career. That means I can visit my specialist whenever I need to without paying outrageous medical bills. I can get regular blood tests to make sure that my lupus hasn't progressed to my organs, and I can buy brand name prescriptions without financially straining my parents. And if I have to leave my father's plan or he changes jobs again, I know that an insurance company will no longer be able to deny me because of my pre-existing condition. Was diagnosed with celiac disease can also not be denied coverage because of her pre-existing condition. The new law has not only given me the freedom to stay covered, but has also freed me and my family from the fear that an insurer could drop me at any moment and force me to, or limit me to go without treatment. Having seen the impact of the new law, I have become an advocate for healthcare reform within my community. I have participated in local events discussing my story, and I have worked with young invincibles to raise awareness about healthcare reform at the UT campus. We even distributed flyers about a new graduation toolkit to help students like me find out how to get coverage even after school. I hope that I can provide a voice for other people all over this nation that have been denied coverage by insurance companies. And I've also gained so much from this new healthcare law. Thank you so much.